Do you often find yourself waking up in the middle of the night because of sharp pain in your calves, hamstrings, or feet? It feels like someone is suddenly twisting your muscles, leaving you in intense discomfort. If you're over 50, nighttime leg cramps are probably a familiar experience. But here's the good news. You can significantly reduce them with something as simple as adjusting your sleeping position with the help of a pillow. Why is your sleeping posture so important? When we sleep, if our legs aren't properly positioned, muscles like the calves and hamstrings can remain overstretched for hours without us realizing it. This strain can trigger a defensive muscle contraction, what we know as a cramp. By adjusting how you position your legs using a support pillow, you can help keep your muscles relaxed throughout the night. It also relieves pressure on your spine and hips, allowing for deeper, more restful sleep and a more comfortable morning wake-up. Here's how to use pillows correctly based on your sleeping position. If you sleep on your side, place a pillow between your knees. This simple change can help keep your spine aligned, prevent your upper leg from pressing down and twisting your lower back, and ease pressure on your hips and knees, especially helpful if you suffer from back pain or arthritis. It also prevents your hamstrings from overstretching due to uneven leg positioning. If you sleep on your back, place a pillow under your knees so your legs bend slightly. This helps reduce the natural curve in your lower back, easing lumbar pressure. It also keeps your calves and thighs in a gently flexed position, helping prevent them from locking up or cramping during the night. Many people report noticeable improvements after just 3 or 4 nights of using pillows this way. Sleep becomes deeper, cramps occur less frequently, and they feel more refreshed in the morning. Best of all, this is a completely natural, drug-free method with no side effects, and it's incredibly easy to do. A few extra tips. Choose a pillow that is soft, but provides enough support to maintain proper alignment. And most importantly, stay consistent. Use this positioning every night to train your body into a healthier sleep habit. Sometimes, the smallest changes, like how you place a pillow, can lead to big improvements in your health. Try it tonight and discover the difference a good night's sleep can make, free from those painful nighttime cramps. Have you ever been deep in sleep, only to be jolted awake by a sharp, stabbing pain in your calf or foot? These sudden leg cramps are more than just uncomfortable. They interrupt your rest and leave you exhausted the next day. This problem becomes even more common as we age, particularly for those in their 50s and beyond. One of the most overlooked causes of these nighttime cramps is a deficiency in magnesium, a crucial mineral responsible for helping muscles relax. Magnesium plays a vital role in regulating both the nervous system and muscle function. While calcium triggers muscles to contract, magnesium is the mineral that tells them to let go. When your body lacks magnesium, your muscles tend to stay tight and are more likely to spasm, especially at night when you're at rest. The challenge is that nearly 60% of people over 50 are not getting enough magnesium. This can be due to poor diet, but also because the body's ability to absorb magnesium through digestion decreases with age. So how can you make up for this deficiency effectively? One powerful method is by using topical magnesium, either in oil or cream form, directly on your skin. Compared to oral supplements, which the body only absorbs about 30% of, topical magnesium delivers the mineral straight into your tissues. It bypasses the digestive system, avoiding common side effects like bloating or diarrhea. Many users have reported noticeable improvements in just 1 to 2 weeks of consistent use. About 30 minutes before bedtime, apply a coin-sized amount of magnesium oil or cream to areas prone to cramping, such as your calves, hamstrings, or feet. Gently massage it in to help absorption and further relax your muscles. You can also apply it after a shower, when your skin is clean and pores are open. If you're unsure whether you're low in magnesium, look for common symptoms like frequent cramps, sore muscles, neck or shoulder stiffness, trouble sleeping, fatigue, or unexplained anxiety. If these sound familiar, topical magnesium could be a safe, easy, and side effect-free way to feel better and sleep more peacefully. But magnesium isn't the only factor to consider. In trying to eat healthier, many people over 50 cut out salt completely, not realizing this could make things worse. Sodium, the main component in table salt, is a critical electrolyte that helps your nerves send signals to muscles. Without enough sodium, those signals can become delayed or erratic, causing cramps to occur, particularly at night. As we age, our bodies are more prone to losing sodium, especially if we drink a lot of water, take diuretics, or sweat heavily. Completely eliminating salt can disturb your electrolyte balance, leading to symptoms like dizziness, fatigue, and more frequent muscle cramps. The key isn't to avoid salt entirely, but to find a healthy balance. According to the American Heart Association, adults need at least 500 milligrams of sodium a day to support basic functions. That's about 1/4 of a teaspoon of salt. If you're drinking a lot of water without replacing sodium or potassium, you could be diluting these key minerals too much. In such cases, a pinch of salt in your meals or a mild electrolyte drink can help restore that balance. Rather than returning to processed, high-sodium foods, try lightly seasoning your home-cooked meals. If you have high blood pressure or other health concerns, talk to your doctor about the right sodium level for you instead of cutting it out entirely. Sometimes, small adjustments, like restoring magnesium through your skin or reintroducing a safe amount of salt to your diet, can have a huge impact on your body's ability to relax, rest, and recover. With consistency and attention to what your body truly needs, you can reduce or even eliminate those painful nighttime cramps and enjoy a deeper, more refreshing sleep. Muscle cramps aren't always a sign of aging. Sometimes, just a small change in your diet, like maintaining a healthy level of salt, can lead to significant improvements in your sleep and overall well-being. The key is to eat smart, stay balanced, and always listen to what your body is telling you. We've all heard the advice to drink plenty of water each day to stay healthy. But did you know that drinking too much water, especially right before bed, can actually increase your chances of getting nighttime leg cramps? This isn't because you're too hydrated, but rather because excessive water intake can dilute the essential electrolytes in your body. And those electrolytes, like sodium, potassium, and magnesium, are absolutely vital for your nervous system and muscle function. Electrolytes play several important roles. They help transmit nerve signals to your muscles, support smooth and coordinated muscle contractions, and regulate fluid balance inside and outside your cells. When you drink too much water in a short period, especially plain water without electrolytes, your body can become imbalanced. This leads to erratic nerve signals and abnormal muscle reactions, resulting in sudden cramps during the night. So, why should you avoid drinking a lot of water before bed? First, it dilutes your body's electrolyte levels, making nighttime cramps more likely. Second, it can cause frequent trips to the bathroom, disrupting your sleep. Third, drinking too much late in the evening can leave you feeling bloated and make it harder to fall into deep, restful sleep. This is especially true for middle-aged and older adults. As we age, our kidneys become less efficient at filtering and retaining water. That's why it's crucial to space out your fluid intake throughout the day instead of loading up in the evening. To stay properly hydrated and avoid cramps, try the following smart hydration tips. Break up your water intake across the day. Sip regularly instead of drinking large amounts at once. Avoid heavy drinking 2 to 3 hours before bedtime, unless you're genuinely thirsty. Pay attention to your body's cues, rather than rigidly aiming for 8 glasses a day. Your water needs vary depending on your weight, activity level, and even the weather. If you sweat heavily, exercise often, or take diuretics, consider lightly replenishing your electrolytes. You can do this by drinking coconut water, adding a small pinch of mineral salt to your water, or using gentle electrolyte tablets, always with guidance from a healthcare provider. The bottom line? Small changes often bring big results. After just a few days of adjusting your water intake, many people report deeper sleep, fewer cramps, and waking up more refreshed. You don't need to drink more, you just need to drink smarter. Turn your hydration habits into a powerful tool for better health, not something that disrupts your muscles and sleep. Leg cramps aren't just a part of getting older. They're something you can absolutely take control of. Nighttime leg cramps are one of the leading causes of sleep disruption for middle-aged and older adults. These sudden painful spasms can jolt you awake in the middle of the night, and the lingering discomfort can leave you tired and sluggish the next day. Rather than relying on medication or simply enduring the pain, there's a simple, natural, and scientifically proven method that can significantly reduce this problem: stretching your muscles regularly. A study published in 2020 examined the effects of daily stretching on adults who frequently experienced nighttime cramps. Participants were divided into two groups. One group performed specific muscle stretches 3 times a day, morning, midday, and evening, while the second group maintained their usual routines without any added stretching. After just 4 weeks, the results were compelling. The group that stretched consistently experienced a 60% reduction in the frequency and severity of leg cramps. That kind of result, achieved without any drugs, expensive treatments, or side effects, is a clear sign that stretching is a powerful yet underused solution. So, how do you stretch effectively? The first stretch targets your calf muscles. Stand facing a wall with your hands resting lightly on it. Step 1 foot back, keeping your knee straight and heel pressed to the floor. Slightly bend your front knee until you feel a gentle stretch in the calf of your back leg. Hold this position for 30 seconds, then switch sides. The second stretch focuses on your hamstrings. Sit on the edge of a stable chair and extend one leg straight in front of you, heel on the floor, toes pointed upward. With your back straight, lean forward slowly from your hips until you feel a stretch in the back of your thigh. Hold for 30 seconds, then switch legs. The third stretch is for your quadriceps. Lie on your side with a pillow supporting your head. Bend the upper leg and gently pull your foot toward your buttocks, using your hand or a towel if needed. Keep your hips aligned and avoid arching your back. Hold for 30 seconds, then switch sides. To maximize results, aim to stretch 3 times a day. In the morning, stretching helps awaken your muscles and improve flexibility after hours of stillness. Around midday, it relieves tension from sitting too long. And at night, it relaxes your muscles and reduces the risk of cramping during sleep. Although the stretches are simple, consistency is what creates lasting change. After just a week or 2 of regular practice, many people notice better sleep, fewer interruptions from cramps, and a greater sense of comfort and flexibility in the morning. To pain-free nights and brighter mornings, take care, and I'll see you in the next video.